most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about dislocated or unstable shoulders, how to avoid surgery and pain. We're going to show you 7 top exercises.
That's right, Bob. So, Bob, this is for a lot of people have had this, but specifically Adrian. I know someone who's dealing with this, and I said I can show you some things. We've had these videos before, but I think this is going to be more comprehensive and even better. This is going to beat out our best.
All right.
But before we go any farther,
if you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, pain-free, and we upload every day.
Every day.
Also, go to bobandbrad.com. Go to the giveaway section. Always giving away something.
Yes.
And this week we're giving away a Fit Glide. We'll show it to you in just a minute. It'll also be pinned to the top of the page at Facebook. You go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
And we have podcasts out there right now, so you can listen to a number of outstanding authors.
The Fit Glide, by the way, it can be used in the chair or in bed. Most people are probably going to use it in a chair, under their desk maybe.
Right. It goes on the floor. You sit on it, and
it's a great way to get exercise. Brad, do you want to just show real quickly how it can be used in bed?
Yeah. Now, on the floor, it's primarily for knee, quadricep, and hamstring. But when you do it in bed, it also gets the hips moving.
Yep.
Yep. So we can do that if you have painful or arthritic knees and hips. Walking, and that is very uncomfortable. This is a really good way to exercise them before you get out of bed or when you're taking a nap.
And the big advantage of it, it's extremely lightweight. Mm-hmm. So even the elderly can pick it up with one finger.
Yeah, and easy to clean. There you go. Wow, one finger, Bob.
Yep.
You were right.
5 pounds, right?
5.2, I think.
Okay, there we go.
Very close to 5. But let's get on to this shoulder thing. I do want to start this out with a story, Bob.
Sure.
It's a short one, so just hang in there.
All right.
Or fast forward.
Don't ramble.
But actually, my mother fell. It was about 15 years ago in the wintertime, landed on her elbow. Somehow, I don't know, but I saw the x-rays. And her shoulder was dislocated into her rib cage like this.
God.
It really hurt just to look at the x-rays. To the ER, they reduced it or brought it back into place. And when she was done, she was lifting her arm about to here. I lived a couple hours from there, and she didn't even do therapy with the exception of range of motion just to get it moving. So whether you have a dislocated shoulder or unstable shoulder, in other words, your shoulder has a tendency to pop out and it's a little uncomfortable and painful, but it goes back in kind of by itself, these exercises are going to work either way.
Right, because you want to strengthen to a large extent, but a partial dislocation could be just like you go partly out of the joint,
right,
and it pops back in.
Exactly.
Exactly.
Bob, I think before we start showing, be careful with
that.
The
hand was grabbing my microphone.
Well, we'll talk about that later, Bob. Anyways, I do want to talk about the anatomy of the shoulder a little bit. Well, we do have to move forward because there's one part. Let's see, can you grab that? Yep, right there.
Oh, there it is.
Thanks, Bob. If you look at this part of the shoulder and we look at the ligaments and tendons that keep that ball in the socket, it's a shallow socket. That's why I have good range of motion. But if they get weak or loose, that socket can move around. Now, this one doesn't move because everything is tight. But if you strengthen the muscles, if they're all intact, all the rotator cuff muscles and the deltoids are all intact, we can strengthen it to get it like this. This is the way it's supposed to be. There is one thing that can be problematic with a shoulder dislocation, and that's if we open it up in here, and there's something called a labrum, which is like a cartilage, which is part of the fossa or the capsule or the joint.
Right.
If that actually has a tear in it, that is one thing where it can be hard for that to heal. It takes a long time for it to heal. If it's a real bad tear, that may need surgery if you want to go back to a high level of activity.
Also, if you're a person that just genetically has really loose ligaments, loose joint, loose capsule.
Yep.
If I remember right, Brad, if you're like under age 17 or something like that, and you're dislocating your shoulder, they're more likely to do surgery than if you are older.
Sure.
Because if you're older, you generally have tighter ligaments.
Sure. In the case where you've had an injury, then I think you're better off. You need to work on strengthening and really
Yeah.
give it a good effort to get that shoulder, so you do not have to have surgery, because there's nothing guaranteeing that surgery is going to fix it.
Easy in any direction, whatever decision you make, the strengthening is going to help the shoulder. I
Yeah.
mean, it's not bad to do.
No.
It's very good to do.
It's going to prepare it for surgery if you have to do that. Otherwise, hopefully you will not need to. Let's show them some exercises.
Sure.
Some key points, so Bob. Number one, we talked about it being good for the unstable or the dislocated shoulder. Number two, we talked about the labrum tear.
Yeah.
That's something to be concerned about. And you're going to have an MRI to really confirm that. X-rays are not going to show a
labrum tear.
No.
Yeah.
And all these exercises that we're going to show you, they should be pain-free.
Right.
If you're working through pain, something's not right. Listen to your body, skip that exercise and go to another one. And that's the thing. These are in order, but you don't have to do them in this order. The first one is not one that you'll continue to do. It's just get range of motion. If you only go this far and it doesn't go any higher, it pops out and that's it, then you need to work some exercise that we're going to show you.
But be careful that you don't go back like this at all, because most people, I think like 90%, they dislocated the shoulder forward.
Yep.
This, when you bring the arm back, it moves the head of the shoulder forward.
Yep.
So you don't want to go. I always tell people there's like a wall right here.
Right.
Don't go past the wall back here.
Sure.
Especially like this. You'll get that apprehensive sign.
Yeah.
You'll feel not good about it. You feel like the shoulder's starting to go out, and you'll want to go
Right.
forward.
Oh, I did want to say, if sleeping on it's uncomfortable, you wake up, it's a lot of pain. You got to do what you can do not to roll over on that. Put pillows on one side of you so you roll into the pillow so you don't sleep on that and dislocate it
Right.
inadvertently.
Not
That's
good,
a big
not
one.
good for healing, not good for
Right.
comfort.
Bob, you want to show them
Sure.
how to
All right.
gain that
You can
flexion
use
motion?
any type of stick. You could use a broomstick. You
Mhm.
could use a PVC pipe. We got the Booyah stick here. It's nice because it's got tips on the end.
Right, nice rubber
Now,
tips.
I use it because I'm taller. Some people, maybe because they're shorter, could start like this.
Yes.
And but it's just a good way to start sneaking up on flexion. So improve the range of motion.
Going up
so you
this
can
way.
start off by working your hand up as high as it feels not painful at
Yeah.
the shoulder, and then you can lean forward like this and put a little traction on the
Yep.
shoulder and stretch it a little bit. Then you can work your way up a little higher. And
Yep.
stretch forward, and eventually you'll get all the way up to the top,
Right.
and regain your motion.
Right.
So then we got to work on strength.
Yeah. I'll show you one way without the what my mother actually used. She just did the old-fashioned wall walk, where you just use
Sure.
your fingers to go up and then back down and back up. And she did that for a number of weeks, and she regained it all by herself without going to therapy. Then she had a range of motion where she could be relatively pain-free without many symptoms. Then she started the exercises
Sure.
that we're going to show you. The first one, scapular retraction, and that means squeezing this. This is going to help posture. If you don't have good posture,
You see how his shoulder blades are coming together? It's positioning the shoulder in such a way that it is a lot more effective and useful.
Yeah, well, the ball is going to stay in the socket much better.
Yes,
So,
exactly.
yeah. So you can do that without resistance. For this, I really think you need some resistance bands if you're really going to attack this shoulder and
Yeah,
get it
if you
be
want to do some
successful.
strengthening.
You need to attach it, and resistance bands, you can hook it into a doorway. They give you an attachment. You can use a doorknob. I've had a lot of patients. We use the wall anchor because it just works really well. Whatever, you need to attach it, and we're going to do the same thing, but look how I use the resistance.
Be a little careful if you go all the way back like this, Brad. Just
Yep.
again, I don't want you to dislocate your shoulder. If you go only to neutral if it feels like feels a little uncomfortable to you.
You're not going to go out like this.
Yeah.
Keep it in here, in tight,
Yeah.
like that. If you need more resistance, just simply take a step back. And if that gets too far, then you just change to a more
Darker band.
darker band.
Yeah.
And it's very, very nice to work with. The next one, the rotator cuff exercise.
This is probably the most important one
Yeah.
right here.
So you take a towel and you fold it up like this, and you'll see why in a second. This elbow is a 90-degree bend here, and I know Adrian's going to be
Yeah,
really
right
good
angle.
at this. Elbow stays in by the rib cage, and we do this motion.
Yep. So the palm is facing in or to the right,
Yep.
and he just brings it out. Now, if you're cheating, you put the towel in there to make sure that you keep the arms against the side. You don't want the, you don't
If
want
that
it
falls
winging.
out, you know you pulled your elbow
Yeah.
too far from your rib cage. So a lot of times I'll have patients use that just for the first few times, and then you get used to keeping that in there. But you can use it all the time if you'd like.
Very important exercise.
The next one is you're going to do going in, which I'm going to show you with the other arm.
Sure.
But you're going to do the same thing and go in. Typically, moving in is a lot stronger. Sometimes you can just double it up and you'll be fine with the same band. And all these we're going to do 10 to 15 reps. And you should not create any sharp pain. It just should be fatigue in those muscles.
Again, you're keeping the elbow at a right angle,
Yep.
and keeping the elbow actually to the side again.
Yep. So these muscles are tightening up and pulling that ball into that socket so that it stays stable and stays where it's supposed
Yeah,
to.
the rotator cuff, it does its job. The four muscles help hold that ball into the socket.
There you go. This is one I like to do is we need to get some weight bearing through that
Sure.
joint and stabilize it.
And plus, you get a little range.
Right.
with this.
Yep. And we're going to start out on a table, and you're going to do 4 motions. You forward and backwards 20 times while you're pushing into the ball with a straight elbow, and then right and left. Don't push so hard that it dislocates.
Yeah, you're
so
keeping
use good
You're
judgment.
keeping a pretty small range here.
Yeah, just a few inches. That's a good point, Bob. 20 that time, and then circles clockwise 20 times. Then go opposite, counterclockwise. And you'll be amazed how those muscles fatigue. So then simply go to the wall at about shoulder level, straight elbow, body weight into it, up and down 20 times. And you can go up to 30 times if you'd like. Then right and left, tight motions, leaning into the ball, clockwise, counterclockwise, and give it a break. You can do the other shoulder if you'd like to.
And the final one, Brad, number 7.
Push-ups, more weight bearing. We're getting more functional. By now, it feels pretty good to do these exercises because you may not be doing 6 and 7, these last two, until you're feeling
Sure.
like a stronger shoulder. I
And-
start push-ups
Against the wall.
against the wall and do this and just see how it feels. If you can do 10 like this, it feels perfectly fine compared to the other shoulder. Then you're going to go to, well, you might want to start on your knees, Bob.
Sure.
Yep. There you go. And you can do 10 of them like this. If this is too easy, you can go right to the GI push-up and work that. Bob, you've been working on your form.
Have I?
Excellent.
It's a little better.
So progress the push-ups. If you get up to 10, 15, it all depends. You know, if you're an athlete
Right.
or if your job, you know, I believe Adrian is building houses, does some real
Sure.
fine work. He was going to need a little more,
Be a little more
Strength.
physical.
Yeah. but I know he's got an athletic background. He will figure it out very well. So I think by the time we get to the end of all these, you're going to have a solid shoulder. You're going to get back, hopefully, no surgery for you, back to a normal life. And like I said, my mother has been doing fine for 15 years, and she's 85 now. And I just checked it
Amazing.
yesterday.
Oh,
yeah.
did you really?
Yeah, and she's up, reaching around, and she's happy with it. So
She's able to slap you?
yeah, oh, yeah. No, I'm just kidding.
No.
All right, very good.
All right. Thanks for watching, folks.
Good luck with that shoulder.